Hello, this is DrTerriMD, and I am checking in with you for TNT with Dr. Terri, Tuesdays and Thursdays with Dr. Terri, where we're going to discuss everything related to health, hearts, and hope. And today's topic is Breastfeeding 101. So for those of you guys who have been following my page, thank you. I think you probably figured out that August is for breastfeeding awareness. And so thank you guys for following the page and sharing about breastfeeding awareness and hopefully encouraging those women in your life who are trying to successfully breastfeed. So I'm a little late today. I had a little technical difficulties, but I'm happy to be here now. And we're going to be talking about Breastfeeding 101, the good, the bad, and yes, the ugly. Believe it or not, there's a little bit of ugly associated with breastfeeding. So we'll talk about that a little bit today as well. So for those of you who are watching, come on in. Thank you for taking a lunch break. It's about 1:40 or so here in Texas, Central Time. So I know that it's different times everywhere else. So thank you for those guys who are able to watch. And for those of you who are joining us on the replay, thank you as well. So don't forget to share. And I hope you guys learn a little bit today about Breastfeeding 101. So first of all, the good. So I like to start with the good because that's what most people usually associate with breastfeeding. So we know that breast is best. And actually, I don't like to say breast is best because breast is actually the norm. It's the standard by which all other formulas are created and formulated and compared. So breast is not best. Breast is the norm. It is the standard. And so what are the three big benefits that we can get from breastfeeding? So remember I said we're going to talk about the good, the bad, and the ugly. So under good, I'd like to start with the health benefits first. So we know that in terms of health benefits for babies, those babies who are exclusively breastfed for at least 6 months will have less risk for the most common infections that we see in babies. And so those infections include gastrointestinal, such as diarrhea, respiratory infections, such as pneumonia, and ear infections. So those are the big three for babies: GI infections like diarrhea, respiratory infections like pneumonia, and ear infections, otitis media. So those babies who are exclusively breastfed for at least 6 months, we know that those babies have decreased risk for infections when compared to those babies who are formula fed. What are some other benefits, the good, associated with breastfeeding? So we also know that there are some later benefits for babies who are exclusively breastfed. And some of those later benefits include decreased risk for type 2 diabetes, decreased risk for obesity, and decreased risk for leukemia in older children who have been exclusively breastfed for at least 6 months. So that's pretty cool. And finally, one of the big benefits for breastfeeding during the newborn period is a decreased risk for SIDS. So those are the things that I would say are the big things to remember under good for breastfeeding. We said we were going to talk about the good, the bad, and the ugly. So under good, we're going to start with medical. So for babies that are exclusively breastfed for at least 6 months, which is the recommendation for the American Academy of Pediatrics, we know that those babies will have decreased risk for stomach infections, lung infections, ear infections, and then later they have decreased risk for obesity, for type 2 diabetes, as well as ear infections. So what about the medical benefits for mom? There are good medical benefits for mom as well. Moms who exclusively breastfeed will have decreased risk for ovarian cancer, as well as breast cancer. And for moms who exclusively breastfeed for 6 months or longer, breastfeeding can serve as a form of natural contraception and help with birth spacing and decrease your risk for preterm birth. So that's pretty cool. So those are the things under good. Those are the medical benefits. There are also some social benefits under good for breastfeeding. And so social benefits are actually my favorite benefits. So we know that mothers who breastfeed produce two hormones. One is called prolactin, P-R-O, and then oxytocin. So for the prolactin, we know that prolactin stimulates the milk production, and the oxytocin allows for the actual contraction of the milk ductules to actually express the milk, help the milk to be expressed. Both of those hormones are called the love hormones. So prolactin and oxytocin are known as the love hormones. And when those hormones are being produced, they are responsible for that really intense bond that mothers feel with their babies when they're breastfeeding. And so they're the bond, they're responsible for that bond that promotes the attachment that mothers feel for their babies when they're breastfeeding. Hi, Dr. White Lewis. Thank you for joining us. And so, hey, Dr. Lakeisha, thank you for joining us. And so that's the second big benefit for breastfeeding. So under good, we said we were going to talk about the good, the bad, and the ugly. We said the medical benefits for babies are decreased risk for respiratory infections like pneumonia, ear infections like otitis, and GI infections like diarrhea. Longer term for babies, we know that babies who have exclusively breastfed for at least 6 months will have decreased risk for type 2 diabetes, as well as obesity, as well as leukemia. For mommies, we know that mommies who exclusively breastfeed for at least 6 months or more will have decreased risk for breast cancer, ovarian cancer, and then we talked about it being a natural form of contraception in terms of spacing. Under social, we talked about the intense bond that mothers will feel when that prolactin and that oxytocin is released. I call those the love hormones, and they are responsible for that increased attachment that mothers feel. The last thing under good is, I would say, would be economic. And for some moms, that is the most important reason, really, to breastfeed. So we said we were going to talk about the good, the bad, and the ugly. So under good, we already addressed medical. We already addressed social, but under economic. So let's just talk about breast milk. Breast milk is perfect. It's already in the perfect container. Like, you don't have to buy any containers. You don't have to get any special tops. You don't have to transport it any special way. Like, it's already there in the breast. The milk is already at the perfect temperature. It's already mixed. You don't have to get any measuring cups and spoons and stuff. It comes out already perfectly made and prepared for your baby. And so it is the most economic way to feed your baby and more inexpensive. And so there are very few therapies in pediatrics that really fulfill the medical, social, and economic benefits. And breast milk definitely meets that. So that's it for good. So we said we were going to talk about the good, the bad, and the ugly. So what about the bad? So although we do support breastfeeding and we do encourage everyone to breastfeed, we know that there are some challenges to breastfeeding. And we also know that not every mom is going to be able to breastfeed and not every baby is going to be able to breastfeed. So the first thing I want to talk about in terms of the bad is some of the challenges with breastfeeding. I had been a pediatrician almost 5 years before I had my first baby and actually had gone through the breastfeeding experience. And I had talked to many mothers about breastfeeding with respect to what I had read in the books and what I understood to be the challenges related to breastfeeding. But then when I actually had to do it, I was like, oh my God, okay, like this is crazy. Like, this is ridiculous. Because when you read the books make it seem like you're going to have your baby's going to come, and then your milk's going to come, and it's going to be la la la, your breasts are going to be full with milk, and your baby's going to nurse, and it's going to be just so fantastic, and then the baby's going to go to sleep, and you're going to go to sleep, and it's just going to be awesome. And it is awesome, but those first 2 to 4 days can be very stressful. And for most moms who are able to breastfeed, but they're not successful with breastfeeding, when they usually stop, it's around day 2 to 3. Because most of the time, the milk does not fully come in until 72 to 96 hours. And before that, you find yourself nursing, and you feel like I don't have enough milk. You may have grandmother or friends saying, oh, the baby's not getting enough. Your baby's hungry. Give the baby a bottle. Your baby's losing weight. Your baby has jaundice. And, you just have all this mommy guilt. And you're wondering, where is my milk? Because you've imagined it in your mind that you're going to have your baby and your breasts are going to be full with milk and your baby's going to be immediately full. And then you're going to go to sleep and it's going to be fine. And that doesn't exactly happen. So I learned that with my first baby. And I really wanted to find every mother I had seen through my entire pediatric residency who I had said, look, just keep pumping. It's going to be fine. Just keep pumping. It's going to be fine. It's going to be fine. I just want to go back and hug all those moms because I really just didn't understand how stressful those first 48 to 72 hours can be. Not for every mom, but for many moms. So that's the first thing I'll say about the bad is just that stressful period while you're waiting for the milk to come in and while you're reminding yourself, hey, I can feed my baby. I am prepared to feed my baby. I have everything I need to feed my baby. And to remind you moms that you need support during this period, and to remind the dads as the support systems that you need to be able to support mom during this period because it takes a while for the milk to come in. We need to make sure mom's getting enough milk, getting enough water so that she can make the milk, that mom's staying hydrated, that mom is getting her rest, because that anxiety affects the baby. And we need to remind moms that it's okay. Babies do lose weight. It's normal to lose weight. Even formula-fed babies lose weight. Babies do get jaundice. All babies get jaundice. We all had jaundice. Maybe not that you could physically see, but jaundice is a normal process that the liver goes through after birth. And most babies will get through that process fine. So the first thing under bad is just to remember that it doesn't exactly appear the way it looks in the books. It's not like you have your baby and then like 1 hour later you have breast full of milk and you fill whole bottles and stuff. You have the colostrum is gold. That's all the babies need. It has a lot of sugar. It has a lot of fat. It keeps the baby very satisfied, and it's more than enough for the baby. But moms, remember, it's not going to necessarily be the way you imagine it in the books, and you might not necessarily see milk from your breast, like a whole lot of milk from your breast, until a couple of days later. Okay, so that's okay. So that's the first thing under bad, is that it can be kind of stressful. The second thing, I want to talk about babies who may not be able to immediately breastfeed. What if you have a preemie? If you have a preemie, depending on how premature they are, they're not going to be able to go to the breast immediately. And a lot of moms get really upset about that. But if your goal is to breastfeed, remember the most important thing is that they get the milk, right? Yes, Jennifer, yes. Jennifer, exactly. Exactly. Like we need to talk to moms more about that first couple of days because it's scary. Hey, but I haven't seen you in a while. Hey, boo-boo. So, okay, so you made me lose my track. Okay. Hey, Jennifer. So that's the first thing. Okay. Is that first couple of days can be stressful. So the second thing under bad is this. Remember, if you have a preemie, they may not be able to go to the breast immediately. We want to let our mom, or if you have a baby that's sick, you may have a term baby with heart problems, or you may have a baby with Down syndrome, or a baby that has an infection. They're not going to be able to go to the breast immediately. And many moms, especially first-time moms, or moms who didn't get to breastfeed before, hey, Dr. Goldie, moms who didn't get to breastfeed before, it's very upsetting if you have a baby that's sick and you don't get to have that experience of breastfeeding that you had imagined. And what I want to say to moms is that I put that under the bad, but not necessarily, because the main thing is we want the baby to get the milk. Right? We want the baby to get the milk. And so you can still pump, moms. You need to have good lactation support. Make sure your partner's supporting you, rubbing your shoulders and rubbing your feet and rubbing your tummy and, bringing you cocoa or whatever you require to be comfortable. And you can still pump. And we can give the milk to your baby in the ICU nursery. Sometimes they have to get it through a feeding tube. Sometimes we'll do a little oral care and just rub the milk on their tongue, and they can get it that way. But the important thing is, moms, they can still get the milk. Even if you don't get to breastfeed like immediately after birth, we can still do skin-to-skin care. We can do non-nutritive sucking where the baby can just lay on your breast and practice suckling at the nipple, although they're getting most of their feeds from the feeding tube, okay? So that's the second thing under the bad, is that sometimes you have a baby who may not be able to breastfeed, but mom, you can still pump and we can still give the baby your milk, okay? Thirdly, sometimes you have a mom who's not able to breastfeed. So the baby's able to, but mom may have had breast surgery or breast reduction surgery. She may have flat nipples. She may have nipples that are too big for the baby's mouth. She may need some assistance for that. Mom may be on some medications for which she can't breastfeed. So for most medications, mothers can breastfeed, but there are some true contraindications to breastfeeding. And those medications include medicines for HIV, medicines for T-cell virus, medicines, some illicit drugs, obviously, some pain medications that mothers are on, as well as some radiation and nuclear therapies that breastfeeding would have to be temporarily interrupted. But for most situations, mom should be able to breastfeed. But if mom has an issue with her breasts, with the nipples and she needs support, we may have to use a nipple shield. We may have to get lactation to help us, or she may not be able to breastfeed. If she still wants to pump, we can work with her with the pumping and stimulate her milk production so that the end goal, remember everyone, is to get the breast milk. And for preemies, we can give them donor breast milk until mom's milk is in. Texas actually has the largest breast milk bank in the U.S. The mommies in Texas donated more milk than the mommies all over the USA. So we have a lot of donor milk here that's been appropriately tested to be able to give to babies. Okay, so under good, just to recap, thanks to those of you who joined us a little late, we discussed the health benefits. We know that breastfed babies will have less ear infections, lung infections, as well as stomach infections. Hey, yay, good. I know, Texas rocks, right? And then under good for mommy, we talked about decreased ovarian cancer, as well as breast cancer and child spacing, like natural contraception. And then under bad, we talked about that stressful period in the beginning while you're waiting for your milk to come in. We talked about sometimes the baby has a problem where the baby cannot breastfeed. Sometimes mom has a problem where mom can't breastfeed. Okay, so what about the ugly? We said we were going to talk about the good, the bad, and the ugly. Okay. So the first thing I want to say on the ugly is something very serious. And actually, this is something you all should share with your friends. Even if you're through having children, if you know someone having children, if you take care of kids, you're around anybody with kids who is providing breast milk. We want to talk about the CDC statement that just came out with respect to cleaning your breast pump equipment appropriately. This is huge for pediatrics. This is huge for neonatology. This is huge for OB. So the CDC just released a statement in June updating their guidelines with respect to cleaning your breast pump equipment. And I must say, my children are 17 and 19. I did not clean my equipment this way. There was a case report, everybody, of a preterm baby. It was a 29, 30 week, 3-pound baby who developed a very serious infection. The baby didn't die, but developed a very serious infection from Chronobacter sakazaki. Can you guys say that? Chronobacter sakazaki. This is a regular bacteria that lives normally in the environment and in our intestine. But this bacteria had grown in the mom's breast pump equipment. So it was in the nipple of the breast pump equipment, the tubing for the breast pump equipment, the funnel, and in the drains in the mom's kitchen. So this was a baby in Pennsylvania who developed a very severe infection, developed a meningitis as well. Hey, Daryl Thompson, that's my classmate, developed meningitis, a very severe infection, you guys, from bacteria. Hey, Kitty Kelly, developed a very serious infection from bacteria that was in the breast pump tubing equipment. Hey, niece Brittany. And so those of you who have friends who are breastfeeding or who work with kids, this is huge. The CDC just released a statement about how to clean the breast pump equipment. There was a preterm baby that got a very serious infection from the tubing, from the mom's breast pump equipment tubing. And in the old days, we encourage moms, hey, Portia James, hey, Dr. James, we encourage moms to clean they could wash their breast pump equipment in the sink, allow it to air dry. But now we know we don't want to do that because you can have bacteria living in the drain. So for this particular mom, the bacteria that the baby acquired is not a new bacteria. It's bacteria that we've seen before. But this is the first case report of a baby that developed a severe infection, a brain infection. Part of the baby's brain actually died. Liquefied is what the description from how severe the meningitis was from the infection from this bacteria in the breast pump tubing equipment. This mom would routinely, and a lot of moms do this. I did this. She would bring her equipment home. She would wash her equipment and allow it to soak in the sink in the water. And then once it had soaked in the sink in the water, she would let it dry in the drain. And then she would seal it in a plastic bag for the next pumping for the baby. So a lot of us soak our dishes in the water. A lot of us leave our dishes in the drain, until maybe we have a full batch in order to wash. The CDC specific recommendations for our equipment now are after every pump. So fellas, dads, moms, everyone who knows somebody who's pumping or breastfeeding, you need to wash the pump after every feed. After every feed, you need to wash your breast pump. Every piece, separate the tubing, the shields, the nipples, everything. Totally separate that. You want to wash that either by hand, never sit it and just leave it in the drain. They recommend washing it immediately by hand and allowing it to air dry. Or you can get a separate basin, you know, those plastic basins, or if you want a metal basin that's just for your breast tubing equipment, and you can wash it in there with your nipple brush and your equipment. Yes, Dr. James, after every feed. Sorry, Portia James. So after every feed, you need to do it. You can't let it sit. Now, if you have a dishwasher, you guys, that has a sanitized setting, you can do that as well. So if you're not going to wash it by hand, they recommend putting it in the dishwasher with hot water and then letting it dry with hot heat. You know, you have the different settings. You can let it air dry. So you want it to dry with the hot air, and you can wash it in the hot water. So you can do it by hand or in your dishwasher. Afterwards, they even recommend you could do the sanitized setting on your dishwasher. You could sanitize it with a steamer. You could boil everything and sanitize it with a steamer. And lastly, something that I learned from the CDC is also, if your dishwasher doesn't have a sanitized setting. I actually checked my dishwasher. We don't have a sanitized setting, so maybe the new ones do. If you don't have a steamer that teaches you how to do it in your microwave, you could boil it old-fashioned, and you could also use chlorine. So if you go to the CDC website, you can actually click on guidelines for breast pump equipment cleaning. The CDC has a new booklet. This is how serious this is. And you can print out the booklet. Someone's calling us. I thought they need to be watching Dr. Terri. Why are they calling? You can actually print out the CDC booklet so that you can get the instructions for how to keep your equipment clean. So make sure, you guys, if you know someone who's pumping, they cannot pump and let that equipment sit in the drain or sit in the sink or sit in dishwater all day. They need to clean it immediately. So this baby got an infection with Coronabacter Sakazaki. The baby did not die, but the baby got a severe meningitis and will have some significant developmental delay from the brain damage. This bacteria has previously been associated with different powdered infant formulas, and we went through that a couple of years ago, evaluating the way powdered formulas are sanitized. And so this was something that was really sad, because we really encourage breastfeeding for preterm babies is really important, especially preventing stomach infections in preterm babies. But this was an unfortunate outcome. They did test all the milk in the hospital as well, and the equipment in the hospital and the preparation there. And the only places they went to the mom's home as well. The only places they found this bacteria were on the breast tubing equipment and on the drain in the kitchen sink. Okay, so that's what I want to say about the ugly. The last thing I want to say about the ugly is, listen, you guys, obviously, I'm a pediatrician. I'm a neonatologist. I support breastfeeding. I breastfed both of my children. As a working mom, it was really hard with my daughter. I had to stop around 9 months. My son, I was able to go till about 15 months or so. But breastfeeding can be hard. And it's interesting in pediatrics, because we've gone from where we were hand in hand in bed with the formula companies, giving formula away in the hospitals and in the diaper bags, and, just pushing formula on everyone, to the whole other end of the spectrum, where we're encouraging breastfeed, 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 which I think is great, because breast is best. But at the end of the day, as your provider, my job is to support your decision as the mom, as a parent, with respect to how you want to feed your baby. And we do know that not every mom is going to be able to breastfeed. Not every baby is going to be able to breastfeed. We did talk about babies with medical problems, but if you have a metabolic problem where you require a special diet, like galactosemia, you're not going to be able to breastfeed. You're going to need a special diet for that. Okay, so we need to recognize that we cannot shame mothers who choose not to breastfeed. Okay, our job is to inform parents of their choices. Inform parents of the pros and cons for different choices, and how we can best benefit their baby. So for the majority of babies, breast milk is going to be the best way to feed those babies, and it has immediate benefits as well as long-term benefits. But if there are medical reasons why the baby can't breastfeed, if there are medical reasons why mother can't breastfeed, or if you simply have decided, I'm not going to breastfeed, then we're going to support you. So I would say under the ugly is also the shaming that some mothers feel because of a decision not to breastfeed. And I don't think that we should shame mothers or give mothers mommy guilt for making those choices. Okay, so I think that's about it. I'm just going to try to just summarize. Thank you guys for joining me. We're going to be here every Tuesday and Thursday, TNT with Dr. Terri, where we're going to talk about health, heart, and hope. I'm a neonatologist here in Dallas, and I consider my mission to inspire families who have to make difficult choices and allow them to navigate journeys with hope. I also consider my mission to train healthcare providers who have to work with families to train them how to have hope, right? So a lot of doctors say we need to be heart healthy, and I say we need to be hope healthy, okay? Hope covers a wealth of problems, okay? So just try to be the light today and try to be hope today. That's my goal every day, to try to inspire hope to families as well as my colleagues. So let's wrap it up. Who is taking notes? Breastfeeding 101, the good, the bad, and the ugly. Good, we have health benefits for mom and baby. Babies will have babies who breastfeed for at least 6 months now, you guys. Remember, at least 6 months will have less risk for ear infection, less risk for pneumonia, and less risk for stomach infection. For those who breastfeed less than 6 months, breast milk is still best, but these benefits we're talking about, they are shown in the groups that breastfeed for at least 6 months. For 4 to 6 months, you don't see the differences as much. The health benefits for mom, we said, were decreased breast cancer, decreased risk for uterine cancer, and a natural form of contraception, losing weight sooner, and a benefit for birth spacing. Long-term benefits for babies, we talked about decreased risk for SIDS. Who doesn't want that? Decreased risk for SIDS, right? Decreased risk for type 2 diabetes, obesity, leukemia. Okay, so those are the health benefits. Social, we talked about moms produce prolactin and oxytocin, and those are the love hormones, and they're responsible for the attachment that we feel with our babies. And then we talked about economic, right? That, it's inexpensive, it's the perfect temperature, it's in the perfect container, you can carry it everywhere, and a lot of our work environments are much more friendly for breastfeeding than they used to be, right, when I was training. So that picture on my flyer was actually me trying to nurse my baby on a breastfeeding pillow while I was working as a neonatology fellow. Okay. Under bad, we talked about even though breast is best, and for most situations that's going to be appropriate, there are situations where the baby is not going to be able to breastfeed. Baby may be premature. Baby may have a heart problem. Baby may have a stomach problem. Baby may have a metabolic problem. Mom may have had a breast reduction. Mom may have flat nipples. Mom may just be too sick or weak, and be upset that she didn't get that initial bonding experience. And so we want to make sure that we emphasize that the important thing is that the baby gets the milk, even if mom chooses not to direct breastfeed. There are some cultures where they choose not to direct breastfeed, but the moms will pump. So we want those moms to know that we can still give the baby your milk. We can do oral care, put the colostrum on the baby's tongue. We can practice on the breast when the baby's stronger. The baby can do some skin-to-skin care, some non-nutritive sucking. So there are ways to meet you in the middle, mommies, families, and friends. So let's just make sure we let our families know that. And finally, the ugly, we talked about that really serious infection that caused the CDC to release a statement with respect to how your breast pump equipment is cleaned. We no longer want to just let it sit in the drain and sit in dish water. We want to wash it immediately after every feed, after every pumping. You want to wash your equipment, preferably in hot water. You can let it air dry. If you have a dishwasher, you want to do it on hot water and let it heat dry. If you have a sanitized setting on your dishwasher, you want to do that. You can also boil the equipment after that to sanitize it. You can steam it to sanitize it or clean it in Clorox. And the CDC has a really nice handout on that. The rare bacteria that this baby that I mentioned earlier that caused the CDC to release their statement was called Coronabacter Sakazaki. Okay. And then also on the ugly, we talked about we're not going to shame mothers who make a different choice if they choose not to breastfeed. Okay. Because at the end of the day, the baby's got to eat. Okay. And so if the baby's not going to have formula, if breast milk, then the baby's going to have formula, because if we don't eat either, we're going to have a bigger problem, right? So that's a different TNT for another day. So I hope you guys are able to tune in Thursday, where we're going to talk about neonatal herpes, and we're going to talk about hugs and kisses and things that are missing. That's right, Jennifer Broder, fed is best. And that's my motto, fed is best. Okay, thank you guys for watching and joining me. I'm sorry I was late. I hope you guys have an amazing day today, and I hope you go and spread hope wherever you go. All right, be the light. Bye-bye.